Good morning, everybody. This is Coffee Pan Dulce, and it is the second Wednesday of August. Actually, it's August 10th. If you're seeing this, quote unquote, live, there's the music. Decided to kick off.
Sorry.
With full disclosure, we do record this late on Monday nights, and we've had a little pre-show technical snafus, but we won't get into that. But how are you doing, Christian?
Wonderful, Jenny. Thank you. You always are such a great cover-upper. So, you know, so thank you for that.
Myself.
I know, but that's okay. That's okay.
I wouldn't have been good at I can tell you that.
I can get my power cord.
Oh, okay. You know, we're all about transparency, and we will never beat Barbara's edition where she was, remember, she had to go to her neighbors because she didn't have, yeah.
That was actually pretty fun. I liked that episode. And I loved Mama Ruth when she gave us a tour of her house. Remember that one episode? And we literally saw every room of her house and every family member that was there that night. Like it was Mama Ruth's world tour, and we're just living in it. You know, we were just there. It's like it's no big deal, Mama Ruth. It's just a show. Right. We're just doing a lot of show. But it was
all the bottles of tequila that were in the background. Okay, all right. So let's get started. Yeah, that's right. All right. Well, welcome everyone to Coffee and Pan Dulce. I'm Christian Cano, one of your co-hosts, along with Jenny Gunn, Barb Bacon, Mama Ruth. We're Mama Ruthless all summer. And we do want to join our special guests that we have. We have returning back, Dr. B. Dr. B is back. Are you, I don't know if are you back in North Carolina? Are you still out? You're muted.
I am muted because my air conditioner makes a lot of noise. So if there's a roar in the background, let me know. But yes, we're still out in beautiful Colorado. If you could see through that window, you'd see my mountain and and all of that. No snow.
The fact that you said
blazes, but
the fact that you said you had your air conditioner on meant that you weren't in Texas. So that's
even Colorado gets a little bit warm during the day, but by bedtime it'll be down in the low 60s again. So
excellent.
Hold up.
Remember that 60s?
I know. Yeah.
and we also want to join, and we're going to have him introduce himself when we go around the Brady Bunch screen. Our friend of our show, Commissioner Mark Jerrell here in Mecklenburg County, North Carolina. Commissioner Jerrell, thank you so much for joining us again. As always, you look fabulous.
So thank you. It's great to be here again with some of my favorite folks. So hello, everybody.
Right. Hello. All right, so let's go ahead and go around a Brady Bunch screen in 30 seconds or less. Introduce yourself and any causes that you have. We'll start with, let's go Jenny, Dr. B, Commissioner Jerrell, and then Barb. We'll end it. Is that okay? All right, go ahead, Jen.
Well, hello, I'm Jenny-Jaymes Gunn. I am a local LGBT advocate and community advocate. Of course, obviously, Moms Demand Action, healthcare justice for all, Black Lives Matter. Just you go down the list of every progressive cause, and I'm probably bleeding my heart right there. And also, it is Charlotte Pride Month. Our Pride Week actually starts pretty kind of unofficially this Sunday, so I'm super excited. It's our first in-person event, full speed ahead in 3 years, actually. So this will be our first one of the 2020s, and this is our third year in, so that makes it interesting. But nonetheless, we're super excited, and we're super excited to have our many esteemed guests from all over the country coming in, and our local fans. So, Dr. B.
Oh, he's muted.
Great. I'm George Bohmfalk, a retired physician. A big advocate for Medicare for all. It's my primary button, but part of healthcare is reproductive healthcare, so I'm all for that. And also, gun violence ends up with a lot of unnecessary healthcare and suicides, and so I'm all for taking measures to reduce gun violence. And like Jenny said, just about every other kind of thing, for voting rights and all sorts of other progressive issues. I'm right on board with you, but those are my main ones. Black Lives Matter, that I certainly have educated myself. I just finished reading Ibram Kendi's big book called Stamped from the Beginning. If you want an encyclopedic review of kind of where racism started out and why, and all the confusing but very important things along the way. I didn't really know about W.E.B. Du Bois, whatever it is, Marcus Garvey, all these very important characters in our history of anti-racism. and how even they were so conflicted and sometimes gave messages that in their hearts they thought was the right thing, but they were actually not the best messages. And all of this has kind of slowed our progress, but it's a very, very important bunch of information. So I recommend that to you.
Thank you.
Well, good evening, everyone. I'm Mark Jerrell, as was stated earlier. I serve you on the Board of County Commissioners representing District 4, which is the eastern part of Mecklenburg County. Think about all of Uptown. And I do have the most diverse district there is, whether you talk racially, culturally, ethnically, socioeconomically, however you slice it, dice it. We have it in District 4, which I love to represent. Most of you may know that I'm passionate about issues of equity, access, opportunity, particularly as it relates to our most vulnerable residents, those who've been marginalized, those who felt like they have not had a voice in this process that we call politics. And so I've tried to make sure that I stay engaged, give them the opportunity to have a representative that's accessible, that's touchable, that is actually listening to what the issues are for our people. I'm passionate about social justice, environmental justice, and just improving the quality of life for all residents here in Mecklenburg County. So it's just an honor to be here and with my fellow panelists.
Hi, I'm Barb Bacon, and I'm a community advocate here in South Charlotte, and working a little bit with a new organization out of Virginia. And they are trying to reduce the number of suicides that are happening by our veterans. So my boyfriend Art has run a marathon with them and raised a lot of money. And he's also running another one this November. And we've just become super involved in that. But I'm also really interested in eliminating or stopping all the gun violence and whatever education that needs. Healthcare for all, and I have a long list myself. I think we all do. So I'm done.
Excellent. Thanks, Barb. And I'm Christian County, your other co-host. As many people know, my buttons are healthcare, Medicare for all, Moms of an Action, gun sense legislation. And actually this week they had their very first in-person meeting since the, at least here in Mecklenburg County, since the COVID pandemic started. And then also In My Heart, Black Lives Matter on behalf of Joe Oldham, who was a guest of ours who died at a very young age last year. So with that said, we do want to salute to our neighbors. Whatever you're drinking this Wednesday morning, I'm drinking coffee again, no longer Cuban coffee, so I don't have the jitters. So I'm very excited about that. Now, Jenny, this is for you because I'm back. We want to thank our Pandusa sponsor and supplier. Hold on. Manolo's Bakery, we have fresh pastries, and they have these little donuts now they make, and they've got these chocolate things. So it's all fresh. It's no longer prop.
So the first fresh Panduces in ages, and you don't have me over to record in your RV because I would have had at least both those donuts would be down in my gullet right now. I would already.
Hey, listen. I was.
Christian, no pig.
They didn't have any. They ran out. Listen, when I went there Monday morning, they were actually busy. They had a whole line. There was these ladies visiting Charlotte from New York, and they were actually there buying all these pastries and Pandusa and everything. So I was so excited.
If you're in the greater Charlotte area,
yes,
not only is the owner Manolo's a great corporate citizen and a locally owned business with phenomenal food made by immigrant hands, but just you should buy from local. You should shop small, especially with our Black and brown businesses, our society. Wherever you live, shop local, shop ethnic, shop Black and brown, shop your Asian shopkeepers. Buy from them. They're the ones that fund your schools and pay for your roads and keep.
They're the ones that are making America great, right?
Yeah, that's right.
100%.
Keeping America great.
Also in District 4 as well. Thank you.
That's right.
Absolutely. What a coincidence. That's phenomenal.
So Jen,
the East Side representing, and just keep that in mind no matter where you live in the United States, that you should help your local economy first and stop doing the businesses with Google machines and the Amazons and all the super big corporations and really focus on local shopkeepers.
Yep. Good job, Jen. Once again, I see you throwing me off guard. I got to go back to the script. All right. Now, Melo's Baker on Central Avenue in Charlotte, North Carolina. Please remember to always buy local, buy black and brown, always buy local wherever you are. All right. See, I'm a routine kind of person. I'm not impromptu. All right, here we go. So with that said, we're going to very quickly, since we value everyone's time, and this is a very important topic. Today's topic is MPX virus outbreak. MPX is what they're using for the term monkeypox. The World Health, I believe the World Health Organization is trying to use MPX instead of monkeypox to kind of downplay the stigmas and things like that. With viruses. And so we're going to use MPX. But before we do that, something breaking happened this week on Monday as we were taping, right before we were taping. Our former president's Mar-a-Lago house in Mar-a-Lago, Florida was raided by the FBI. We wouldn't have known it, but he tweeted he tweets through someone else how outraged he is that they invaded his privacy, and no president ever has been treated so poorly, as he said, because he's not really president. That's what he said. All right. The second thing is our Senate did something amazing this weekend. The Democrats actually outmaneuvered the Republicans and passed a really cool bill. I don't even know what it is, but I know it was really cool. And so I don't know if anybody wants to comment on that. And the last thing, which is appropriate for this show, and one of the reasons we needed to talk about this and we changed the topic, Dr. B, what is the congressperson in your district's name? How do you pronounce her name?
Oh, the lovely Lauren Boebert.
Okay, Lauren Boebert said that she had some interesting things to say about monkeypox. And she also is part of the group that is saying that we should round up the gays, put them in concentration camps so they don't spread monkeypox to everyone. This is why we have to misspell some of the things, and I don't know if we can hear, but we're going to try to educate each other. So with that said, anybody want to comment on any of those in 30 seconds or less?
I'll fire away because
go ahead, Jen. 30 seconds.
It's spicy. Boebert, she shouldn't be worried about rounding up anybody, and she should keep her husband away from minor children, especially girls, and bowling alleys. So we don't really need any medical commentary or any.
Hey, Jenna, I forgot. I found it. She said that monkeypox is really a conspiracy by the Democrats to interrupt the midterms.
Yes, of course. Of course. Let's throw one more virus onto our population because that really helped out Trump, didn't it? Anyway, you can't spell dumb without saying Boebert. They're synonymous. But anyway, that's a waste of time. Trump, thoughts and prayers. Sincerely.
Are you lying?
Almost hold it in. I hope he holds his breath and dances on the mic. But, all right. That's a long time coming. He deserves whatever he does.
And the Senate bill, you want to comment?
So the Senate bill, the anti-inflation bill is going to accomplish a bunch of things. For one, it is going to attack our overall deficit by $300 billion. It is going to attack the hamstrung Medicare Medicaid system to where it's going to allow them to directly negotiate with pharmaceutical companies, which they weren't allowed to do before. So not only is it going to save a tremendous amount of money, altogether, this bill is going to do two things. It is going to alleviate a lot of not failed programs, but less funded programs than necessary. And the second thing it's going to do is allow, Medicare and Medicaid, the largest buyer of pharmaceuticals in the world, to actually negotiate and do market forces. The thing that Republicans and Libertarians always talk about but never do. This actually accomplishes that, believe it or not.
All right.
So
excellent.
It'll get us on par with a lot of other countries.
George Bush.
Thanks, Jen. Yeah, Jane, I don't mean to cut you off, Jen, but we got a lot of other people, and I know you and I are going to talk about this on your show later. But anybody else want to comment on any of those three topics in 30 seconds or less?
I'm not an expert on this bill, but my understanding first on the Medicare drug price negotiations, it's going to be a very short, limited list. So it's not across the board negotiation, but it's better than nothing. The other thing is there's an awful lot on climate change that there's some carbon emission type things that they say is going to be one of the most effective, not enough, but one of the most effective climate change measures in a long time. I'm not so concerned about reducing the deficit because I don't view that as the biggest problem facing the country. But the other thing is, I understand they're giving like 80 billion or something to the IRS so they can maybe start going after some higher income tax cheats. And the history is that for every dollar that the IRS spends trying to collect from tax cheats, they get like $10 in return. So it's incomprehensible. Well, maybe it's not, kind of why Republicans have fought in giving more power to the IRS. And I think the reason is because the people that donate to them are perfectly happy with the IRS not being very effective. But anyway, I think the IRS empowerment and the climate change effects are very important in this legislation.
Okay, Barb, you want to comment on any of those?
I'll follow up to Dr. B. It always irritated me when they passed some of the Medicare things George Bush Jr. did. He took away the power to negotiate Medicare pricing. And this, I understand that it's only a select few drugs, but they're very expensive drugs. But with the hope from my pharmaceutical friends that I've been talking that are scared what's going to happen. I said, yeah, well, you'll get smaller bonuses, boo-hoo, you know. It kind of leads the path to future negotiations, and at least maybe they'll think about not raising prices every year like they're doing, because some of them, they have 20 years exclusivity. When I was in pharmaceuticals, it was 7 years. So who greased those skids? No. So
wow, I didn't know that.
Yeah, 20 years. That's ridiculous.
Okay. Commissioner Jerrell, do you want to comment on any of those before we take our first break and then go into our topic?
Absolutely. So, I mean, I think this bill is significant. I think it's one of the most significant pieces of legislation that's passed in recent years. Just think about this fact, and I'm sensitive to this because I have a lot of seniors in my district, but when you think about the ability for Medicare to negotiate prescription drug prices directly and capping that cost at about $2,000 for our seniors, I think that is huge. I think that's something that's going to reverberate as time goes on. So that's number one. Dr. B is exactly right with respect to the climate and energy provisions. Almost $400 billion is my understanding. I think the exact number is about $370 billion, what I read earlier. And again, I don't know enough to be dangerous. Okay, so I'm just talking about at a very, very high level. But when you talk about, you know, the ability to cut greenhouse gas emissions, we're trying to reduce that 40% below where we were in 2005. Again, I think I'm always railing against incrementalism. And when you look at some of the provisions in this bill, you know, I'm really proud that the party pushed the way they did. I don't care that the vote was that 51-50, Vice President had to be the tiebreaker. I think the bottom line is the bill was passed, and now we have a significant piece of legislation that we can implement that's going to change the lives of people moving forward, and generations will feel this.
Yep.
Excellent. Well, thank you so much, Commissioner Jerrell, spoken just like my future mayor or congressperson. So I'll throw that in there. Okay, so with that said, let's take our first break. We'll take our first break on Coffee Pan Dulce. We'll be right back in 30 seconds. Hey, everyone. Thank you so much for watching our Coffee Pan Dulce show every week. Don't forget, you can watch us visually on our video podcast platforms on Facebook and YouTube. But you can also listen to us on your favorite audio podcast platforms like Apple, Amazon, iHeartRadio, Spotify, and all of the other ones that your favorite, well, whatever your favorite is. Once again, thank you for watching us on Coffee Pan Dulce. We'll dance out. All right, well, welcome back. And once again, thank you for your comments on those three topics. There were like 10. We could have talked about a lot of things. There's a lot of things going on, but we'd be here forever, as we always are.
Just to clarify what Commissioner Jerrell just said, He's exactly right. It's $369 billion to energy security and climate change. So it's a dual package of making sure that we switch from petroleum-based products to primarily solar, electric, alternative energies, and probably some nuclear. And also, too, in the investment side of it, $64 billion to shore up the ACA as well, to cut out some deficiencies, fully funded in many ways, and help and bring costs down for the average American. So those were in what they call the investment side of this thing.
Mm-hmm.
On the revenue raise side, this bill will raise $739 billion. We'll put back into the government coffers. One, by what Christian said about the IRS enforcement, should add up to $124 billion. The carried interest loophole, $14 billion. Prescription drug reform, $288 billion, and a 15% minimum corporate tax. Which is going to be at $313 billion. This in many ways is like Mark Jerrell said, one of the most significant pieces of legislation that's been passed probably in a couple of decades. Because it hits our biggest deficiencies we're facing, including the 40% reduction from 2005 numbers that brings us more in line with the Kyoto Accords in Japan. So we definitely need to hit these before we melt. So
thanks.
But we also saw the continued power of high money lobbyists because Kristen Sinema eliminated that carried interest loophole thing. So that's not part of the package, according to my understanding. I think at the last minute they took it out. But the graph that they put up on the Twitter machine, they still left it on. But it's actually the smallest of the savings. So it took it from, I think, 739 to 725 billion, which still is huge. So that we take some of that and invest it back into real Americans, and the rest we can chip the deficit down to skewed, which also with inflationary pressures and money supply. So it is
Jen. Hey, Jen, thank you. We're going to go to our topic, but can't we just all agree? Or I know we can't hear. Wasn't it great to see them accomplish something? I mean, it was like, wow, they actually negotiated and did what you're supposed to do, and I'm impressed.
The Congress actually operated like what a Congress is supposed to.
Is that crazy? That's incredible. That's incredible.
Well, it's a win for the people, and that's what happens when the people demand more of their electeds. They get more, and so when you sit back and you allow people to play games, you get the results that we actually saw in the past. But now I think everyone is starting to get the message that the people are demanding that the people that represent them do much better to provide to change the quality of life that people want. And people are looking, they're more forward thinking today than they've ever been before. And they know what's at stake. And so that's what you're seeing. What you saw is really a result of the people pushing, I think.
I've got a question, Mark. I wonder how much, because the Kansas vote last week sent shockwaves through the country of saying, this is what we want, and a ton of new registered voters voted in that election and by an overwhelming margin affirmed abortion and reproductive health care. I think that almost sent a message to Congress saying, you need to step up, and I mean, because everybody, even Fox News was talking about it, changing the game. And I don't think it's the coincidence that right after that, Manchin folded on a lot of things, and it is as an elected official. And I guess my question to you is, when you see something in our community, for example, that maybe changes the game a little bit, or maybe a tax vote went one way or the other, does it create a conversation in the Board of County Commissioners, for example, when you go, oh wow, that was kind of surprising, or that kind of puts you back on your heels a little bit, and do you think that would push a legislation body like that, being an office?
Commissioner Jerrell, if you could answer her question in 30 seconds.
All right, and 10 seconds already gone. So, I think it causes all of us to take notice, Jenny. To your point, local level is a lot different than national politics. We touch more people, and we have to be much more responsive. But I certainly think it makes us take notice.
I didn't think it would be that fast. Okay, I'm sorry. All right, okay, let's jump to the topic because, yeah, sorry. So the topic is MPX virus outbreak. I'm just going to share with you what is occurring, and I'm sure everyone has kind of done the research. And we did hope to have someone from Mecklenburg County Health Department, but they are so busy with so much going on, and I'm sure admittedly, we didn't ask him until Thursday prior to our recording date. There are, I spent a month every year in our undisclosed location, Key West. And this year, before we were going, we get emails from the Key West, but specifically from the gay Key West groups about what's going on and so forth. And I've been keeping track of wherever I go from the gay communities since the HIV pandemic in the early 90s. When they started telling us to, a lot of things that they wouldn't maybe necessarily publicize in the mainstream media, they would specifically. So if you went to a dance bar or something back in the early days, you would see this big poster by the urinal that said, "You safe sex, use condoms, you this." It's just kind of public health information. So before we went to our undisclosed location, we got an email saying there was a meningitis outbreak in South Florida. So we contacted our doctor and they said, "Okay, get the meningitis vaccine." When we got there, the report was there's a monkeypox outbreak in Europe. And then it apparently came to South Florida. The second weekend we were in Florida, there's this big gay men's kind of retreat group. They do their meeting just like any kind of rave or whatever, I don't know what you want to call it. It would be no similar to the NASCAR events where everyone kind of goes to events and are close to each other. 4 days later, there was an outbreak in South Florida, and they wouldn't publicize where it was from, but common sense would tell you this is kind of interesting. So how they were publicizing it there was they were putting posters on urinals. They were saying if you're having intimacy with other people, they didn't use the word gay. They just said with other people, because if you're, and so when we came back here, and I had heard from Jenny that there was some outbreak, maybe some individuals in North Carolina. And when they came back here, all week long on the station I listened to, they had been doing reports about monkeypox vaccines and so forth. And during every show, they would have a picture of two white gay men holding hands with a rainbow, this one, a rainbow thing. And it said, gay men, but not everyone. So knowing how living through the 80s crisis where my family was afraid to hug us because they didn't know how AIDS was, spread and so forth. And they were told, well, we don't know. It really concerned me that we were assuming that this only gay men were getting this. It's just people, the virus doesn't know if you're gay. It's in South Florida, they were really pushing housekeepers, people who clean beds, people who touch beds of people who are traveling internationally because it rubs off on their skin. Here, there's no mention of that here. It's all focused on that. So I know that we're not Mecklenburg County Health Department or North Carolina, and we're in a different environment. So that's where I'm coming from is educating us on what we think.
I can kind of speak to this. So according Quality North Carolina, which I'm a PAC member of, had a in-house training on this, and they had several people from the state, including a doctor that is an expert on infectious diseases and that sort of thing. And they said you can get it from bedding, you can get it from sheets, anything that you can continually have skin to object or skin to skin contact. So just like the chicken pox, if you ever had the chicken pox when you were a kiddo, the pox will kind of fester up, and it's almost like a sunburn. It'll get all messy, and there'll be fluids, and then it'll kind of gap over in the later stages, and then eventually just fall off. Well, the MPX, or as most people know it right now, still monkeypox, it does that same process. They're just more prominent, it is slightly more deadly than the chicken pox, but not much. But it's not as contagious as the chicken pox. Like you can literally brush by your sibling, and that's how I got it.
Yeah.
My brother and I, we were covered in little scabs within days of getting the chicken pox. So it's anybody can get it. Kids can get it. Babies can get it. Pregnant people. There's been a case in the United States of a pregnant person that got the monkeypox. So it's not immune to anyone. It's just a little bit more common in the communities where men have sex with men. A lot of it is because they have more intimate events. They have more things that are a little bit more aggressive, but it doesn't. It can easily anybody, because where a lot of these originate from. It's not limited to any one group of people. So, and no community, no ethnicity, nobody's immune to this because it is a pox, just like smallpox. It's related to the smallpox family.
Sure. Well, let's get Dr. B to jump in, and thank you, Jen, very much. Dr. B, do you have any comments on? And first of all, I don't want to compare this to the HIV crisis. I was just
they're different. They're different.
Very different. Okay.
To be very clearly repeated several on the call. It's not an STI. It's not an STD. It has nothing to do with sex, intercourse or anything like this. This is on your skin, sometimes just inside your mouth, but it's on the epidural, somewhere is where.
Okay, Dr. B.
So kind of the hooker is that I think everybody is aware that even though it's not officially or technically a sexually transmitted disease, because as Jenny said, you don't have to be having sex to get it. You can just any rubbing together of an open lesion with somebody else's open skin, like a little sore or something, can transmit it. It doesn't have to be through sex. But the fact of the matter is that most cases so far have been related to male to male sexual acts. That's just it. And obviously, there's a lot of concern about how people overreacted and kind of panicked with the HIV epidemic and stigmatized gay people and wanted to do things like Lauren Boebert evidently just kind of said, which would be wholly inappropriate. So I think it calls for a time of sober, calm realization of what's really kind of going on and what we need to do to be safe. And all this stuff about, you can get it from, if somebody rubs their stuff on a pole in the subway, you can get it, or the bed sheets. I mean, all those things are certainly technically possible, but those aren't the biggest concerns, and people don't need to panic about that. Now, it turns out that there does seem to be some aerosol transmission. So if you know somebody has it, or if you're riding in a subway, it might be smart to wear a mask or kind of keep your distance. But we got lots of reasons to wear masks and keep our distance still, don't we? So, again, it's a deal. It is related to smallpox, and we can talk about the vaccine that's available for it and how it relates to smallpox or whatever. But again, the really important thing to remember is I think based on what I read today, there have been no deaths so far in the United States, and only I think 6 or 7 worldwide. So it's not a terribly fatal disease like HIV and like smallpox, which has like about a 40% or 30 fatality rate. Most cases are mild. You kind of have these little lesions, and then they'll kind of clear up. Some people might not have any lesions. It is possible to be asymptomatic from this, but even if you got it, most folks recover within 2 to 4 weeks without any treatment. So to a certain extent, it's almost like, a bad cold or something. And it's not, as we say, easily transmissible. So another thing, there's evidence that if you were vaccinated for smallpox as a child, as almost every single person in the United States would, your cases will probably be milder than somebody, say, in Africa who wasn't vaccinated for smallpox. So there's a lot of carryover between those two.
Interesting. But Commissioner Jerrell, I know you can't speak on behalf of the Mecklenburg County Health Department unless you want to. But how are they? I've seen what I've seen in the news. I know that there's a 2,000 wait list in North Carolina or Mecklenburg County for the monkeypox, the MPX vaccine. Any comments?
Yeah, so certainly can't speak on behalf of Mecklenburg County. public health, where Dr. Washington, I think, is doing, and his team are doing a great job. I know that they're trying to lead with education. They're trying to be proactive. They set up some vaccination sort of clinics over the weekend. They've really identified the highest risk populations, which I think is smart. One of the things that we've learned from COVID is that we have to be proactive. We can't be back on our heels. So one of the things that concerned me and the data that I saw for here in Mecklenburg County, while we have a small number of cases, we have approximately a little bit over half the cases that have been reported throughout the state. So when you look at that from a proportional perspective, that's really concerning to me. And then when you break it down, about 80% of the cases are impacting African-American men. And so here in Mecklenburg County. So once again, Christian and team, we see a disparity again among communities of color. And so it just behooves us from a public health perspective to continue to get out, to continue to educate, be proactive, and make sure that we dispel myths and that people understand. And we've got to continue to advocate for more vaccines and continue to stay present in the community.
Hey, Barb, do you have any comments before I ask Dr. B a question? And then Jenny as well. Then we'll take our second break.
Good.
Okay. All right. Let's go ahead and take our second break. Our second break is actually the MPX PSA that Jenny did over a month ago. She's been far ahead of all of this, and we'll be playing her PSA, and we'll be right back in 30 seconds.
Hey y'all, a very important PSA. Monkeypox, a viral infection similar to chickenpox, is on the rise. There's been over 1,500 cases documented in the United States. If you've been exposed to the pox by a lover or by any other intimate contact, make sure you can contact your county official or your personal physician. To learn more, you can contact any of your county health officials and see about a vaccine and or possible mitigating the symptoms. Be safe out there and have a fun summer. Bye.
Thank you, Boo, for that information.
All right. Well, welcome.
Bye.
Thank you. One of the questions I have, Dr. B, and I know you as a retired physician, there's things that we don't know in the general public. There's things that we think we know, especially now with social media. We all think we're doctors, but I know that, and you've heard me when my doctor has told me something and I'm like, they don't really mean that. Maybe I can do this and I can really get around it. Is it frustrating? Well, I assume, you hearing what's going on with, the monkeypox. And the reason I'm asking this question, because when I was younger and the HIV epidemic was starting, late 80s, early 90s, I remember being so focused on what they were telling me about safety and so forth. And I remember meeting older individuals that had been like in the 70s and the 80s, I would call them boomers. And they were all about, they're not going to stop my sexual rights. They're not going to, it's the government trying to stop us from doing this. And I was obviously the one who wanted to be wrapped in bubble wrap. And there was another group of population of people who said, I'm not going to stop what I'm doing because I am who I am. Is it frustrating for you? Because I guess I'm one of those persons who wants to be in bubble wrap always. There's always going to be a population of all groups that is like, you're not the boss of me, kind of individuals. And does that, I assume, is that what they're concerned about with monkeypox, is that people aren't going to take this seriously?
Yeah, in fact, the CDC recommendations just kind of came out, a few days ago. Do not say avoid, same-sex sex. They say, you might kind of think about taking some precautions. You might limit the number of your sexual partners if you were, fairly promiscuous and had a large number, on a regular basis. You might kind of try to limit that. It's funny that during the COVID period, a lot of people developed what they call little pods of acquaintances or friends, maybe 5 to 7 or something like that, that they all shared the same philosophy about the vaccination and about wearing masks and being protected. So they were very comfortable interacting, getting together for dinner, as opposed to just staying in your apartment by yourself all the time. So the CDC recommends forming, sexual pods just to kind of reduce the number. They say up front, we learned during AIDS that telling people not to have sex is kind of like Nancy Reagan telling people just say no about drugs. It ain't going to work. So don't waste your breath and your PSA energy giving a message that is totally ineffectual. It might be a nice message, but it doesn't work. And so that I think is the main message from CDC is, come on, be smart about it. Try to limit your exposure, but being realistic, you can't tell people just not to have any exposure at all. So I think that's probably the main CDC message.
And so my next question is to Jenny, then I have one for Commissioner Jerrell, and Barbara, jump in as always, anytime. Hey, Jenny, do you think that this messaging, like with Lauren, her, I can't pronounce her name, the crazy lady from Colorado, and then the leading candidate for Senate in Arizona, her group is also part of the ones that's saying we need to put the gays in concentration camps. And next, I can just hear Jerry Falwell Jr. or someone saying, this is God.
Not,
well, yeah,
he's been pretty quiet since the pool boy. I
could just hear one of them saying, "This is God's saying that gay, homosexuality, equality of marriage is bringing this on them," or something. Is this going to impact pride?
No, it's not going to impact it at all unless you're an idiot. You can't take a mouth breathers like that probably can barely find their way to their bathroom in the morning. We're not talking about people that are going to get Mensa applications or Oxford applications anytime soon, or Bobbert's.
But they're going to say it.
I think they gifted her a GED.
But Jenny, right before Pride, before Pride, and we only got 2 more weeks. We're going to start hearing it here in Charlotte. We're hear the hateful rhetoric. Yep.
Hey, this is just the flavor of the day. So I'm whatever the other side wants to say, it's mildly entertaining, and if anything, I'm going to take what they say, I'm going to put it over here, and I'm going to do what I always do. And I think you can't really blame your actions on the reaction of those idiots. You've got to live your life. You know what you can live with. Obviously, I'm not Christian. I'm not in a bum rush to go out and get the pox. That's not really my gift to myself. I am, I would use common sense like I would do in regards to STDs. It's not like gonorrhea has gone away, or syphilis, or any of the other STIs and STDs. We're in an adult world, and adult things happen. And you just got to make things make sense and communicate the best way and navigate it. But it's not gonna hurt pride in Charlotte.
Yeah. Okay.
That's not gonna put the brakes on that at all. I think most people. I think the only deficit we're gonna have is making sure our most vulnerable groups in our community, and especially men of color, get the messaging better, because I think in a lot of times, and some of this is a cultural thing, and I harken back to the film festival, and we had an HIV film in 2019, and then we had a discussion panel, and one of the people that was there, that was a guest, was a young man in his early 20s, African American, and he had HIV. And he said one of the reasons he played so loose and passed the rules is that he saw every film out there only had white men getting HIV, and culturally he thought, well, white men just don't get it. And Hollywood sent that message, and our society sent this message, and we get in these silos, and we've done the LGBT community a huge disservice, and especially all communities of color are always not going to get the proper information. There's going to be a lot of disinformation, and I think we need to do a better job. That's part of social justice, is making sure our most vulnerable parts of our community get the proper information, get the proper funding, get the proper access to the tools to be safe, whether it's COVID, whether it's MPX, whether it's HIV. Black maternal health care is abysmal in this country. It always seems that every time we talk about a health crisis, those communities of color are the ones that get screwed. There's no other way of saying it. They just don't get the justice. So
that was my question for Commissioner Jerrell, and I hate to put you on the spot, Commissioner Jerrell, but I know you mentioned something about maybe I heard that we've learned a lot from the COVID experience. on how we message. Or I think I have seen the county change from when we started to going to where in Jenny and ours, in all of our businesses backgrounds, be where your customer is. And when we started to see Mech Health actually going to South End, and it was like, and they were for a year ahead, they were telling us they are catching COVID at the highest rates. And we're like, well, then why don't you go there? That's where they're catching it. They're the ones that are spreading it. And so I guess what I'm saying is that I do hope, and I don't know if this is a question, I do hope our county health department is following the lead of other county health departments and stop spending like any advertising money on mainstream and spend it on the niche markets, like the Black radio stations, the Black television stations, the Spanish radios, to get the message out. Because when I heard during the first one, the COVID, and we were being told that it was disproportionately hurting Black and brown populations, and I heard that on WCNC, I'm like, they're watching Telemundo. They're not watching WCNC, and so I hope that when y'all go into budgeting that maybe y'all have already, that there is money being spent on those newspapers, the local newspapers, all that kind of stuff. I don't know if you want to comment on that.
So I'd like to. I think you all, you both raised some fantastic points. I could tell you this, that to respond to you, Christian, you're absolutely right. I mean, we have got to change the playbook, okay? We can't keep going to page 22 every time there's a crisis and trying to enact the same playbook from 1963, right? That's not effective. That's not helping. And I can tell you that when you say you hope we're taking a page out of, from other counties, I can say definitively that none of us are so self-absorbed where we are not going to try to leverage best practices from no matter where they come, where they're from. We have to do that. We have a responsibility to the people that we serve, and that is to protect them, number one. And so from a health perspective, we're certainly going to do that. But I can also tell you that through the leadership of, I've got some fantastic colleagues who certainly are, way smarter than I am with respect to a lot of these things. And they often raise outstanding questions. They have great suggestions. And to the credit of Dr. Washington and his team, they listen, they absorb, they synthesize, and then they're able to implement specific strategies that speak to exactly what you're talking about. And I think you can see that played out. We are in spaces and places where we have not been previously, and it just speaks to your point. So we're all thinking along those same lines, but it's up to the community to hold us accountable. Where do we have blind spots? What are we missing? So that we can lift those things up. Sometimes there's a reason why, and sometimes it's a miss. And so we encourage everyone who's listening to please let us know if you have suggestions. Reach out so that we can. I mean, it's important for us not to be right. It's important for us to get it right.
Thank you so much. And with that said, we're going to take our last break. Our last break talks about a show that Jenny leads. It's very well organized. I always have to say that because she's very well organized. The show that comes on about 30 minutes after this one on Wednesdays at 11:30 in the morning. It's called Two Queers in a Truck, and she has all kinds of stuff to talk about. So we will be right back after she tells us about that show.
Up next is Two Queers in a Truck with Jenny and Christian. And hope you guys tune in. We'll see you in about 15 to 20 minutes. Thank you.
All right, well, welcome back. We only have about 14 minutes left, and we do value everyone's time. Let's talk about vaccines. Does anyone have information about vaccines, or do I need to get it? I mean, I'll take it. Me, I have meningitis shot, everything.
The problem is there isn't enough vaccine approved for all the people that need it. And so the bashing that I've heard is of the Biden administration and the FDA that they haven't gotten around to it. And once again, it's administrative. I don't know what happened, and they're not saying, but they're doing everything they can to fix it. But in the meantime, I agree with Dr. B and Jenny and Mr. Jerrell, Commissioner Jerrell. Educate, educate, educate. So when the time comes, nobody's surprised or unaware. And once again, I'm talking to my friends in the pharmaceutical industry, and they're like, this hit them, they weren't even aware of it. So that's very concerning, but hopefully.
Well, I learned a bunch today about this that I didn't know, and like most stories, when you dig into them, it gets pretty interesting. Indeed, there does seem to have been some lack of urgency on the part of the government, the FDA and HHS and things like that. But then there's more, and it seems that we had like 20 million doses of the virus of the vaccine, and this vaccine was developed for smallpox, and there was concern that if smallpox was weaponized and suddenly there was this huge outbreak, that's why we had this little stockpile. Well, nothing really happened with the smallpox weaponization, and we kind of let a lot of those vaccine doses expire. They kind of went out of date. And these are all manufactured by a company in Denmark. And so we put in some orders, but we didn't think the outbreak was really going to be serious, so we didn't order very much. And then we suddenly kind of wanted a bunch in the little vials, and the Denmark company said, we got the vaccine here, but it's not in the little vials. And they said, okay, we'll put them in the vials. So that required another company to put them in the vials, and the FDA had to go over and inspect that. So there's just all these little red tapes that kind of make sense on the one hand, and but they all kind of take time. So that's what's going on right now. And another thing that's almost comical is that there's a real process to ship the vaccine. They can't just take it off the shelf and put it in. They have to package it in these little cocoons, and they have to freeze it for a certain number of days. And the mechanisms they have to lower the temperature in Denmark, for whatever reason, are more effective than what we have available here. So they can't ship it all, or it all go bad. And then comically, they, for some reason, were going to fly it from, I don't know, Denmark to Germany or something, but there was a pilot strike on the Danish airline or something. And so they had to put it in trucks and drive it to Germany in order to ship it over here. So it's like, my goodness, it's like, it's always something, right?
It was Biden's fault.
Yeah. So you can't blame that on Biden, right? So there are a lot of things. It's not just kind of FDA's fault. And the other thing that is exciting to me is they say this vaccine is normally injected into the fat beneath your skin, but the fat that's in everybody between the skin and the muscle. And there's research going on right now that suggests that if you inject it a little bit more carefully, it might take a few more seconds into the actual skin, kind of like anybody that's had a TB test a long time ago. They create this little wheel, this little bubble in your skin with the injection rather than stick it down deeper. That it's actually more effective, such that you can use like 1/5 of the normal dose.
Oh, wow.
Well, suddenly that would make 5 times the amount of vaccine available. So there's a lot going on. It's a moving kind of an issue, and time will tell. But yeah, we need more vaccine and more people get it.
I have a really, really quick question, because I know Jenny and Commissioner Jerrell want to jump in, because we only have about 10 minutes left.
Sure.
What is especially you, Barb, because you spent years in the pharmaceutical industry. This says it expires July 1st.
Right.
I'm just using this as an example, but I eat them for 2 months later, because that's just
for 10 years.
Yeah, that's just really used by. That's not really, I smell the milk when it says it expires. When a vaccine says it expires July 1st, can you possibly use it later? Does it really, like, molecules just stop on July 1st? My point is, I would rather have a 1 month expired vaccine than wait a very long time for, and that's me.
Fresh batch.
For a first batch. I know that I was trying to be funny about that, but is there really just a cutoff date? I assume, is that?
For people dispensing an injectable drug, yes.
Okay.
And I've known doctors that have older things and they use them. Pills are a little bit different. I've got pharmacist friends that say, well, for this, you can take it 2 or 3 months after. The problem is, at what point does the chemical compound start to break down, and they don't know what they do, or whether they work, whether they're hurting something else.
They can become harmful.
Yeah, but injectables, not that I know of. It's pretty
Dr.
much.
B?
Yeah, I think the term is biological effectiveness, and You know, so you can measure an effectiveness of a vaccine, and at a certain date, it'll start to kind of drop off. And nobody wants to kind of be blamed for giving somebody an ineffective medicine because it was past that date. So there's a certain liability issue, but also, you know, common sense. So yeah, if you were a couple of days over, it's not like all of a sudden the clock stops and these things become totally ineffective. It's kind of a cautionary thing, and you want to make sure.
I was just curious because, you know, that's how I think.
Commissioner
Jerrell,
it's not automatic
than anything.
Yeah, Commissioner Jerrell, do you have anything you want to add? We only have about 8 minutes left, and then I know Jenny may want to say something else.
What Barb and Dr. B just said.
Well, you know, just to let you know, Commissioner Jerrell, WCNC, because that's the station I watch. I give it away all the time. The NBC affiliate here said that there was a 2,000 person wait list in North Carolina. I don't know if it's Mecklenburg County or North Carolina, but yet there's no wait list in South Carolina. And when you ask for a vaccine, they don't ask for residency. All you have to do is sign up, whether it's COVID, whatever, you just go there. They don't have proof of identification. So I don't know if Jenny, do you want to, I don't want to tell people go to South Carolina because I don't want their, you know, they got a crazy governor and he probably watches this show. And so what do you think, Jen? Should people, I don't know.
I mean, if I was going to do something like that, there's probably several neighboring states that maybe have a little bit extra that we possibly don't have, and I'll leave it at that. You know, as far as the logistics of the vaccine, there was a lot of things in play, a lot what Dr. B said, and really, it's kind of like COVID. It kind of showed us what we are up against in a changed climate.
Mm-hmm.
One of the things that they predicted 20 and 30 years ago, and a lot of the modeling is to see more outbreaks because when the climate changes, and you see a consistent 1 to 2 to 3 degrees more Celsius, that does affect even pathogens and viruses and things.
I see what you mean.
And we're going to have to find and think more along the lines of being a little bit more proactive. You know, this outbreak started heavily in Europe in like May, and we didn't really get on the stick until about early July. And so we had a 60-day lead time, again, just like COVID. We had a pretty good lead time as well. And, you know, there's a little bit of misunderstanding between that Denmark producer and the United States. There was a few things that said, oh, we do have this here, but then on second look, there were some issues. But it does bring up a very good point that if smallpox ever were to get weaponized, or there would be another pox, you know, there's tons of different poxes. Smallpox has a lot of cousins. And plus new stuff, you know, this particular strain was definitely a, you know, animal to human jump. And they still haven't really found ground zero on this. So they're not 100% sure why this particular strain got so aggressive and as far as making this leap. But they have had outbreaks before in specific regions of Africa, but they've never seen an outbreak like this in a while in other continents. But again, changed climate changes the game, you know, and when you're lifting up permafrost and you're keeping the temperature just a little bit warmer, the viruses will thrive a little bit better. There's a little bit longer seasons of different things, and it's going to happen. So it's just kind of a reality.
I've always wondered, I know this is not a question because we have to wrap up now. I've always wondered, like within the LGBTQ community, I'm generalizing, we tend to be, especially after the AIDS epidemic, we tend to be a little bit more, we try to be a little bit more educated about our health and about things and about, you know, so forth. That's why our vaccination rates during COVID was so high. It was like one of the highest populations that was double vaxxed, you know, boosted and all kinds of stuff. And we tend to be, our generalizing, a segment that would report things quickly. If something is wrong with me, I go to the doctor because most of us have health care. Most of us have those, we have a primary care physician, so we tend to be. So I've always wondered, whenever there seems to be a population that like, let's say with the Mecklenburg County Health Department or any group, that their numbers look high, do they take into consideration that this just is a population that reports it higher, that there may be other populations that have it, but they're too ashamed to report it? I mean, is that, I guess I just asked that question because I'm wondering if, I assume that's in their model, or Dr. B, do you know if that's, or?
Well, my understanding is that I don't think it's a shame to report it or anything, but just like with COVID, I think most people agree that the numbers that we have now are probably underreported. I mean, as a couple of days ago, I think there were about 6,600 cases reported in the United States, 16,000 worldwide, things like that. And the interesting thing is there have been outbreaks before. There was one in 2003 in Milwaukee, some kid that got bitten by a prairie dog that got infected by an African rat that was illegally imported by some exotic pet dealer. Wow. So, and there were only like, I think, 70 cases associated with that. And there was another outbreak in Singapore a couple of years ago, and one person in the United States was reported to have gotten it last year. So it's been kind of tinkering around, but this is kind of the first big explosion, and that's kind of the big concern.
Okay. I guess we'll wrap up. Is everybody okay? Thank you so much. We appreciate your time, and thank you so much, Commissioner Jerrell, for taking the time to come on here. And we do hope that our Mecklenburg County Health Department continues to they're doing a great job. I see them on the news all the time, and they're always out there. So with that said, we're going to go around the Brady Bunch screen. Oh, I was just going to say, whenever they say about the LGBT community that they spread it because they're too close with each other, I'm like, it's almost like people who are saying, well, I'm not close with my spouse. I don't know why they're so huggy. It's like, why are you so sad that they actually love each other, close to each other? It's like, anyway, all right, let's go around I don't know where I went with that. Let's go around the Brady Bunch screen. Tell us who you're going to be next. Dr. B, Jenny, Barbara, and then Commissioner Jerrell, please.
I'm going to still be out here in Colorado until till the leaves change, and just doing good things and playing a little music and taking a few hikes and smelling the flowers.
Pretty much laying low, until the start of this Pride Week coming up. So my first event is on the 14th on Sunday, and then I'll be going pretty hard for 7-8 days in a row. And Christian and Andrew and myself we're VIPs this year, so we're going to be hanging out festivities and maybe even doing a few on the spot, little short takes while we're out there, and throw a little shade some people's way, just to have a little tongue-in-cheek fun. But I'm super excited to have this in-person Pride coming up. I know our community misses it. We had our film festival this spring, and not only was it the largest turnout we've had for a film festival ever, but it was also in the shortest period of time. It was a 5-day festival instead of 2019 7-day. But I really saw a gratefulness and a thankfulness that they could just see other people again and get back to some kind of new normal, and a lot of tears and a lot of smiles. And for my community, I'm very grateful to have it back and see all my friends. And I don't know, have some hope.
Yeah.
Thank you, Jen.
We all need hope, right?
Yes.
I have another foundation that I'm contemplating working with, so I'll be meeting with them this week. But otherwise, it's my 2 trips to Winston-Salem and my 2 friends that I'm helping out, and like Jenny and I've been doing. And other than that, I'm still trying to find some chill time for myself. I know the weather, I'm getting grumpy. I hate this hot weather.
Well, let me just say thank you for having me again. I always love being here, and it's a great conversation tonight. So I'll be on your ballot. This is where I'll be in November. Actually. But other than that, though, you can always find me on the east side. I'm in the Near East, Middle East, or Far East of my district. So you can find me in one of those places. Just remember, Mark for the people. Thanks, everybody.
Thank you.
So Commissioner Jerrell, are you saying you're going to be on my congressional 14th ballot? Is that, yes, finally. All right. I'm voting for whoever's on that ballot. Well, not whoever, but the person on there is, okay. All right. So with that said, I will be here. Or actually, I'll be camping. I don't know where I'll be. And then next week is Pride. So I'm excited to be in the VIP tent with Jenny. So we've been looking forward to this. And thank you, Jenny, so much for everything you do for our community. And as I see back here, real men support women. This is a sign that we have in our yard. That one, and a uterus is not a witch or property. So we do hope every woman, I don't care who you vote for, but just go out and vote. If we see women voting at 80%, 90%, we can change the country.
That's right.
So, all right. I thought I'd throw that in there. Okay. Well, thank you very much, Jenny. We'll get ready for our show, and we're going to end this one. You ready? I don't know if you can do this.
Just remember Kansas, folks. Just remember Kansas. We can make
Bye,
change.
y'all. Bye, y'all. See you next week.
Hey, y'all, thanks for watching. And if you guys didn't watch, we'd be sitting there talking to ourselves. We wouldn't be very interested. I appreciate Dr. B and Commissioner Mark Jerrell, our esteemed guest, and helping us to get the state of our county and what's going on with MPX and life in general in Mecklenburg County. Be safe out there. No licking, no doorknobs. Have a good day. Bye.
Bye, y'all.
Next up, thanks for watching Coffee and Pan Dulce. Next up is Two Queers in a Truck. Stay tuned.